Yes.
So I'm going to continue much more briefly now with an overview of the introduction of heat treatment of PFC products. I'm going to start by returning to the annex that we looked at earlier, a different part of it. So it's that document INQY. And if you could go through, please. To page 15. Now, this is a table of products, PFC concentrates, that we've prepared in the inquiry team. This table contains PFC concentrates products that were routinely issued. It doesn't contain all of the various products that were being developed, were sometimes issued for trial but not issued routinely. It provides a helpful route map just for and an overview of where we're going to go. As you can see, it's divided into Factor 8 and Factor 9. And I'll just pick up a few dates in the middle column for Factor 8. We can see the very early introduction of Factor 8 concentrate cone fraction 1 in 1956. Then the next date, 1974, that's PFC's standard intermediate Factor 8 concentrate, sometimes known as NY. The NY prefix refers to a link between PFC and colleagues at New York University. And then you can see we go from 1974 to December 1984, when PFC's first heat-treated product is introduced. There's then a series of other heat-treated products. The first one that's introduced is dry heat-treated for 2 hours at 68 degrees. The next one is introduced around September, October 1985. It's a similar product again, 8Y, with some stabilizers added. Dry heat treated at the same temperature, 68 degrees, but this time for 24 hours. And then the next date, it's half cut off at the bottom. It's April to May 1987. It's a product which becomes known as Z8, April, May 1987. If you go on to the next page, Sully, you'll just be able to see the... Oh, that's perfect, thank you. And that's a product which is dry heat treated again for 72 hours, initially at 75 degrees and eventually for 80 degrees. And we can contrast, and I won't pick up the 1991 product which changes approach. We can contrast that Factor 8 timeline with the Factor 9 timeline, which is in the right-hand column. So the story starts in 1967, I've covered already, PPSB. 1971, for haemophilia B patients, that's replaced by DFIX. And we can then see that the next key date for Factor 9 is August 1985, when a heat-treated Factor 9 product, DFIX, is introduced. 2 points to note about that introduction. First of all, as you can see from this table, it's later than the heat-treated Factor 8 product. The second point is that it is heat-treated for longer at a higher temperature from the first iteration, and that remains the same product through the rest of the time period that we're looking at. So that's just to provide an overview of where we'll be going with some of these heat-treated products. And I'm going to turn to a very brief chronology that goes back in time the early 1980s, and I'm really just going to pick out a few key dates, focusing on Factor 8 first. So far as the inquiry has been able to identify, PFC and the wider SNBTS first begin to look into the possibility of heat treating Factor 8 concentrates in late 1980. That seems to follow a conference that took place in Germany, in Bonn, in October 1980, that was attended by Professor Cash. During that conference, the German company Beringwerk, I'm sure I pronounced that wrong, report that they have been able to heat treat a Factor 8 product using pasteurization as opposed to dry heat treatment. Pasteurization, I think, like Mr. Hill said, is more like a water bath. Dry heat treatment is more like an oven. You can get a sense of the reaction to that claim from a letter that Professor Cash wrote to Mr. Watt on the 27th of October 1980. He briefly described what the company was saying, this German company was saying, and he ends with, "Sounds unbelievable, thought you might be interested." And as we're looking at heat treatment in this very early period, the focus is on trying to inactivate hepatitis B, and then also non-A, non-B hepatitis, factor VIII concentrates. Picked matters up in late 1981, the following year, when the SNBTS, through Professor Cash, establishes the factor VIII study group. Now, the factor VIII study group looks at a whole series of different issues and problems relating to factor VIII. It establishes a subgroup, the safety action group, which focuses on viral inactivation. Now, that group meets in January 1982, prepares a first report around March 1982. At least in that early period, it's made up of Dr. Cuthbertson from the PFC, two other members, Drs. Pepper and Somerville. So includes non-PFC members as well from the wider SNBTS. A report's prepared by that safety action group on possible viral inactivation of factor VIII, considering different methods, considering the possibility of inactivating hepatitis. By the time of a March 1982 meeting of the factor VIII study group, there was a discussion of the proposals. At that time, the suggestion of the safety action group was that proposals to achieve a hepatitis-reduced factor VIII product, and that was how it was phrased at the time, hepatitis-reduced product, would take time and considerable investment. It was thought that this could not be achieved in less than 2 years. So March 1982, a suggestion to produce a hepatitis-reduced product, factor VIII product, would be around 2 years. The group continues investigating viral inactivation through the remainder of 1982. There are various important parts of the chronology that are picked up here in the written note, including meetings internationally that Dr. Foster attends, various other meetings and reports that are prepared, but I won't go into the detail of those now. By the time we get to October 1982, the factor VIII study group is suggesting that its first option, its preferred option for viral inactivation is heat treatment. Now, the context for that is that in this early period, various other possible viral inactivation methods are being considered. Irradiation, for example, treatment with detergents. There's a focus, more of a focus from this point, on heat treatment. The kind of heat treatment that the group is focusing on is pasteurization. Alongside that focus on pasteurization, what we can see in these documents from this early period is a belief that part of the key to producing successfully a virally inactivated factor VIII is to have a higher purity concentrate. So there's investigation into producing higher purity concentrates alongside investigations into pasteurization. That gets us to around January 1983. This work is ongoing. There's some discussion on the relationship between this work on heat treatment and self-sufficiency. There's a meeting of SNBTS and haemophilia directors on the 21st of January 1983, during which Mr. Watt explains, or sets out rather, this link explicitly. I'll just read out a couple of parts of the passage that's recorded in the minutes. It said that Mr. Watt explained the problems which had to be overcome in preserving acceptable yields and providing a product which was not too expensive. considerations that were of less importance with the commercial product. Around this time, early 1983, commercial producers of factor concentrates were also trying to market virally inactivated products. He said that during the meeting, directors were made aware of fierce competition facing the PFC from commercial concerns and were asked to bear in mind the stated policy for the Scottish Health Service to be self-supporting in blood products. The PSC would have limited amounts of heat-treated factorates available for trials in the near future, and haemophilia directors agreed to support the PFC as much as possible in the development and clinical trials of the NHS product. So that gets us to early 1983. In the first few months of 1983, reference begins to be made to AIDS. In the first references that we can see that are set out in the written note, there's not always a direct link between AIDS and PFC's heat treatment strategy, but a direct link is made soon thereafter in May 1983, and it's a document I'm going to bring up. So it's PRSE 3 zeros, 4 ones. One. Let me just check I've got the right. So all I'm going to do with this document is highlight the context and read out some of the passages. It's an important document. As you'll see, it's drafted by Dr. Foster, so I'm not going to suggest any inferences or meaning that might be drawn from it beyond what's set out in the document. Before we go to that, it might just be worth noting the date, 3rd of May 1983. Now, the direct relevance of this document for present purposes is to try and work out what the impact was of reports of AIDS on PFC's heat treatment strategy. It also has a place in the inquiry's wider investigation into knowledge and understanding of the risk of AIDS and how that was communicated to patients. I've mentioned the date, 3rd of May 1983, because it is almost exactly the same date as the message which went out from Professor Bloom through the Haemophilia Society to patients about AIDS and what the reaction should be to AIDS. Now, I'm not suggesting that there's any direct link between Dr. Foster, the PFC, and Professor Bloom, but when we are looking at how the AIDS risk is set out in this document and how the AIDS risk was set out in that Professor Bloom communication to patients, it's worth just noting that timing.
Well, the 2 days before was the 1st of May. It was a Sunday. And that's when the Sunday papers carried articles concerning the risk of AIDS. So the talk of killer blood. So that may well have been something in the mind of anyone who was concerned with producing something which might transmit the cause of AIDS.
It may well have been, sir. I'll obviously leave that to Dr. Foster,
yes,
whoever's giving evidence, but you're quite right, sir. Those articles appeared, and in fact, they prompted the message from Professor Bloom. A request went out to him from the Haemophilia Society in response to those articles to say, please, can you prepare a message for patients as a result of what's been said. I think he drafts it around the 3rd of May, goes out the following day. If we can scroll down, please, just to get the first few passages. We can see at the top, actually, sorry, can we get the top half of that? That's great. Until very recently, and this summarises the background to PFC's heat treatment programme at the time. Dr. Foster says, until very recently, the objective of our heat treatment programme was to cope with the hepatitis problem in haemophiliacs. Because severe haemophiliacs have been heavily exposed to untreated products, then only mild and moderate haemophiliacs could benefit from a treated product in the foreseeable future. it was estimated that the mild moderate group could use up to 30% of the total factor VIII. This estimate, plus the fact that these patients are presently likely to be treated with single donor cryoprecipitate, have determined our present strategy, i.e. that we will plan for 4 to 6 pilot scale lots during 1983, begin a full-scale plant to handle 30% production for 1984 to 85 at the earliest, and that mild and moderate haemophiliacs can continue to receive single donor cryo meanwhile. He then goes on to say, and if we can scroll down, Sally, I'll pick up the impact of AIDS. The possibility that another more serious infectious agent, AIDS, is now involved suggests that we may need to review this strategy. In the new scenario, the haemophiliacs most at risk are the severes rather than the mild and moderates. There's already evidence of a panic recourse to cryoprecipitate. In the absence of any hard data, heat treatment of everything looks at the moment to be the most likely possibility that we have to face up to. If this is so, then we will have to plan to pasteurize all of the factor VIII rather than 30%, and we may also want to review the timescales noted above. And if we could go down a bit further, please. Timing may become crucial for a number of reasons. The publicised view that factor VIII is infectious and that there may be a long incubation period, i.e. 3 years. We may argue that this has not been proven, but hard data, one way or the other, could take years to achieve. Meanwhile, decisions will probably be taken according to the worst case hypothesis.
So just pause there for a moment. Yes, that's Mr. Watt, the last sentence, expressing a view that people will err on the safe side.
It looks like that, so I should clarify. This is Dr. Foster.
The word err is simply adopting a colloquial expression. It's not a suggestion that there will be an error to do so.
No, sir. Just for the transcript, rather than you probably said, this is a Dr. Foster memo rather than Mr. Watt.
Oh, I'm sorry. Well, he can explain.
Yes.
What he had in mind.
Quite.
Thank you.
So I'm not going to comment too much on what all of this might mean.
No,
Dr. Foster's going to be here, but
ultimately it's for me having listened to submissions.
yes. And then the final passage on this page, there are some who would find a move back to cryo attractive. And if this gathers momentum, it would only need one suspected case from NHS factor VIII. We could see our fresh frozen plasma disappear overnight. If we go over to the next page, please. The top, Dr. Foster says, there may therefore be a case for accelerating our heat treatment programme. While I do not disagree with point 2 above, I believe point 2 is about plans for building a full-scale plant. It may be possible to introduce an intermediate stage, still using the pasteurisation cabinets. We probably have most of the equipment to allow us to do this already. He then sets out some detail of the technical process that would be involved in the rest of this memo. So that's all I wanted to take from this document for now. In the written note, we've recorded that it appears that a change of approach was agreed at the PFC as following this memo in a meeting which may have followed it. I believe that involved scaling up the pasteurisation product, but I'll allow Dr. Foster and Dr. Perry perhaps to explain that further. The Safety Action Group was still continuing its work during this period. It met again on the 15th of June 1983, and I just want to take you to a record of its meeting very briefly. It's PRSE 303460. Now, I just want to highlight 2 passages. If we can have the top of of this page, where we can see the date and those who are present. These are the members of the Safety Action Group. So there's Dr. Cuthbertson of the PFC, and then there's two other members who are not from the PFC, reflecting that this is part of a wider SNBTS initiative. And if we go down to the bottom of this page, there's a summary there of the approach at the PFC to heat treatment at this time. It says considerable progress has been made at PFC in producing heat-treated Factor VIII, and clinical trials should start towards the end of the summer in Glasgow and Edinburgh. No infectious model for non-A, non-B has been produced yet. The putative AIDS virus must be considered as a potential hazard in Factor VIII concentrates. Now, a lot of this document involves technical issues relating to viral inactivation. There's one more passage I wanted to draw out that links into the wider context, and that's at page 5, please. Under the heading AIDS, it's just the first two or three sentences. Although not proven to be a virus, this apparently infectious agent has been found in haemophiliacs in the UK. It would seem wise to try somehow to encompass AIDS inactivation along with hepatitis B and non-A, non-B inactivation schemes. And there's then a discussion of the impact of that on viral inactivation methods. Now, June 1983, so we have previously had a presentation on the first patient of which the inquiry is aware in the UK with haemophilia to exhibit symptoms of AIDS, one of Professor Bloom's patients.
Well, he probably, it was said, that's how it was reported to the NIBSC, that he probably had AIDS.
That's right, sir. There was a report on the 6th of May 1983 to the CDSC about this patient. It may be that that's the patient who's been referred to here. And there was another patient in Bristol. I'm not quite so familiar with the chronology of that patient, but my understanding is that it may not have become common knowledge until later in 1983 that there was a Bristol patient with AIDS too. I'm going to move forward to the beginning of 1984. Now, Doctors Foster and Perry will be able to correct me if I'm wrong, but my understanding is that the trials of PFC's first heat-treated Factor VIII products didn't take place as it was thought they might during 1983, during summer or later 1983, that they in fact started towards the start of 1984, January to March. An important date in the chronology to note is January 1984. Professor Ludlam reports an adverse reaction in one of his patients who has been treated with this pasteurized trial Factor VIII. He reports symptoms like chest pain, retching. Dr. Forbes provides a report of these early observations of the product in March 1984 with no adverse reactions. Now, during the remainder of the first half of 1984 and the beginning of the second, it appears that the focus of the PFC continues to be on producing a pasteurized Factor VIII product. Now, that's not to say that there wasn't some consideration given to dry heat treatment. I believe starting during 1983, I won't go into the details of that, but in terms of the overall focus, it seems that it continued to be pasteurization until later in 1984. There's then a major shift that occurs in PFC's strategy, and it appears to be linked to two events around the same time. The first is the discovery in October 1984 that a cohort of patients at Edinburgh who had been treated with PFC factor VIII had developed antibodies to HIV, HTLV3 as it was then. Now, the inquiries explored the timing related to that discovery and other evidence. No doubt it can be picked up with the witnesses we'll be hearing from, so I won't go into it any further. Alongside that discovery, on the 1st to 2nd of November 1984, a plasma fractionation conference took place in the Netherlands, in somewhere called Groningen. It was attended by Dr. Foster and Dr. Perry and Dr. McIntosh as well at the PFC. And during that conference, it was reported that dry heat treatment appeared to successfully inactivate HIV. Those attendees come back from the conference. There is a major change in PFC's approach during the course of November and December 1983 to dry heating the existing PFC factor VIII concentrate. And what appears to have taken place is that the stocks which existed of PFC NY normal intermediate unheated product were heat treated from December, a point in December 1984. That product begins to be sent out to RTCs in Scotland and also to haemophilia centres, and the PFC and the wider SNBTS introduce or appear to introduce a policy of seeking to recall unheated product that was at RTCs and that was also in blood banks and possibly stocks of home-treated product as well, though it may be that there's more to explore on those details. So we get into 1985, and this first heat-treated product is being introduced. The type of heat treatment, as I've said, was dry heat treatment. It was heat-treated at 68 degrees for 2 hours. Now that gets us into 1985. I'm going to say very little about what happened with factor IX during the period we just looked at, the 83 to 84 period, other than to say that there was some early investigation into heat treating factor IX during that period. A heat treated product, factor IX, is not introduced, as we've seen also in December 1984. It comes a little later. So we're into 1985. PFC is continuing to explore further the heat treatment of its factor VIII product, and in particular to explore different heat treatment viral inactivation regimes being applied to its product, not just 68 degrees for 2 hours. We set out the detail of some of those attempts in the written note. What appears to take place is that from around January to September 1985, the first heat-treated product, the first-generation product, 68 degrees for 2 hours, is issued. From around September 1985, it's replaced by a second-generation product, which is heated at 68 degrees for 24 hours. Now, as part of that policy of introducing the second generation of product, there appears to have been a PFC policy of exhausting existing stocks of heat-treated product before bringing in the new generation one. So in other words, it may be that a product treated for 24 hours at 68 degrees was available earlier, but before it was introduced to RTCs and to patients, they would exhaust the first generation product, all of that would be used up. And the new product would be introduced through a batch dedication scheme that had by then been introduced at the PFC. I mentioned this briefly earlier. I'm going to go into very little detail about it, sir. Safe to note that in the written presentation, we've picked up a suggestion from Professor Cash in 1983, November 1983, that the SNBTS and PFC might need to be considering some sort of batch dedication arrangement. He raises it again, Professor Cash, at the 2nd of February 1984 meeting that we looked at earlier. There's then a period between February 1984 and early 1985 where it's not quite clear, at least from the documents, what happens to this proposal to introduce a batch dedication system. It then comes in around March 1985, and I'm just going to go to a document which briefly explains it. It's PRSE 304101. This is, you can see from the title, a PFC report that was prepared for a meeting in March 1985. And if we go through to page 5, please. So there are other parts of this document that are certainly worth considering. It has an update on heat treatment. If we go down to the second half of the page, there's an explanation of the approach to batch dedication. It says the ability to prospectively dedicate whole batches of product to individual patients or groups of patients depends for success on substantial reserves of product. Such reserves are now available, and it is now possible to implement a system of limited batch exposure. Briefly, such a system would operate by dividing patients into groups on a regional basis, with each group receiving product from a designated batch held at the RTC. RTCs would also carry reserve batches for replacement of active batches when these became exhausted. Then it sets out how groups of patients might be divided up, and then at the bottom of this section of the report, it says present estimates indicate that such a system can be in place by the end of March 1985, with existing product which will sustain supply until autumn 1985. Now, it appears that a batch dedication system was introduced around this time, and that it remains in place until at least sometime in 1987. The exact end date isn't completely clear from the documents. So we're now into later 1985. PFC's second generation heat-treated factor 8, heated for 24 hours, is being issued. Research has been undertaken into a third generation of product. And so far as it appears from the documents, that appears to be because it was understood at the time that heat treating, dry heat treating at 68 degrees for 24 hours should be successful in inactivating HIV, HDLV3, but was thought unlikely to inactivate non-A, non-B hepatitis. In other words, this 68 degrees 24-hour product could still transmit non-A, non-B hepatitis. We're done with that document now, thanks, Sully. So there then begins more research rather, on this new product, which becomes to be known as Z8. It seems that there's a change of direction which happens towards the end of December 1985 with a focus on the Z8 product, which will involve heating for 72 hours at 80 degrees, i.e. the same amount of time, the same temperature as the BPL-8Y product, which we heard about last week during the hearings on England and Wales. I'm not going to go into all of the detail around the development of Z8. what would appear to happen is that the product is being developed. Around August 1986, there are some difficulties encountered in manufacturing it at a large scale, scaling it up from the initial small test batches. There's a reference in a 29th of August 1986 letter from Dr. Perry to an 11th hour problem with freeze drying. We get to late 1986, around December 1986, and it appears that Z8, this new product, which it is hoped will be effective against not only non-B hepatitis as well as HIV, is ready for clinical trial. Now, while this product development was taking place, there had been a number of letters and some discussions around what's termed in the documents compensation arrangements for patients. Now, what this relates to is the arrangements for compensating patients who participate in clinical trials in the case of an adverse reaction. Dr. Ludlam had raised this issue some time earlier. It had not been resolved. Resolving it required the involvement of the Scottish Home and Health Department and others. We get to the beginning of 1987. Dr. Ludlam raises this concern again and effectively appears to say, I'm not prepared to enter my patients into the clinical trials of Z8 until this issue has been resolved. There's some evidence that haemophilia centre directors in other parts of Scotland adopt a similar position. There's correspondence back and forth with a number of individuals, including at the Scottish Home and Health Department. It appears around February 1987, some form of compensation arrangement is agreed, at least for the clinical trial aspect. Trials appear to begin around February 1987 of Z8. We then get to April, and it seems that the SNBTS and PFC, following those clinical trials, are ready to start issuing Z8 on more of a routine basis. It seems, generally speaking, to be fed into that batch dedication system that we discussed, and to reflect the policy of exhausting stocks. At least from the documents, there's a suggestion that those existing policies might be subject to a caveat for certain patients, in particular patients who had not been treated previously with factor concentrates or treated very little with factor concentrates, on the basis that they were understood to be the highest priority for a new product, which was hoped to be effective against non-A, non-B hepatitis, as well as other viruses. Now, that's a brief overview of the position on heat treatment of factor VIII products. Factor IX, we've covered in a reasonable amount of detail in the written note. As we get into 1985, with a heat-treated factor VIII product in existence, but no heat-treated factor IX, haemophilia centre directors start to ask PFC what might be happening and when they might expect a heat-treated factor IX. Around that time, and in fact even before, from some years previously, there's an explanation that in order to introduce a factor IX heat-treated product, there might be additional complexities because of the need to ensure that the product is not going to result in, I'm going to always pronounce this wrong,
Thrombogenicity.
Thrombogenicity, sir, thank you. I understand that to be, might cause blood clots in patients. That required an additional level of testing involving animal studies. That is one of the explanations provided for why the heat-treated factor IX was going to be introduced later. In the meantime, during the course of 1985, some haemophilia centre directors appeared to decide that while they're waiting for the PFC to introduce its product, they'll start buying some commercial heat-treated factor IX, and that would explain why in the graphs that we looked at earlier, there is an appearance of commercial factor IX concentrate in 1985 when there hadn't been before that. The reasons why the Factor 9 heat-treated product that is introduced around August 1985 by the PFC is immediately at the higher end of the heat treatment regimes that we've been considering, 80 degrees for 72 hours, is related to the nature of a Factor 9 molecule as against the Factor 8 molecule. I won't try to provide any more explanation of that issue. That gets us to the end of 1987 and more or less to the end of this presentation. In the written note, we've covered the 1988 period to 1991. I don't propose to go through any of the details now. For those who'd like to review that portion of the written note again, what will become apparent is that in the later 1980s, Scottish Haemophilia Centre directors start to purchase heat-treated products, including heat-treated Factor 8 products again, rather than just relying on Z8. The reasons for that are set out in the written note. There is also, during this period, another arrangement between Professor Ludlam and Dr. Main in Northern Ireland to exchange PFC products for commercial products. And we set out the chronology of that agreement and some correspondence which points to the reasoning and the rationale behind it. So that was all I was intending to say in the oral presentation for Scotland and Northern Ireland. As I've said many times, there's more detail in the written note. I'm going to be handing over now to Mr. Hill, who's going to be dealing with pool sizes, but I wonder if before that it might be appropriate to take a short break.
Well, let's take an early break in that case, and come back at 10 to 3. 10 to 3.